So now we'll come to the ring analogs of phenothiazines, which are nothing but the thioxanthines. So if you take this thioxanthines, they differ from phenothiazines. That is, so if you take in phenothiazines, the nitrogen atom will be present in this position. Okay, so here the nitrogen atom is being replaced by the carbon atom. Okay, so those compounds are called as the thioxanthines. Okay, so phenothiazine, here the nitrogen will be there, whereas in thioxanthines it will be consisting of the carbon atom. Okay, so the thioxanthines differ from phenothiazines by the replacement of nitrogen in the central ring with a carbon link side chain. So here these two compounds, they are the thioxanthine derivatives. One is chlorprothixene and another is thiothixene. So you can see here both places, here it is carbon atom, but they vary in the side chain. Okay, so here second position it is the chlorine group, whereas in thiothixene it consists of the N dimethyl sulfonamide. N dimethyl sulfonamide group is present. Okay, and here the nitrogen atom, the terminal nitrogen atom, it is part of the heterocyclic ring, piperazine ring. Okay, so these compounds, they are the thioxanthine derivatives which are used as antipsychotic drugs. So now we come to the structure of chlorprothixene. So you can see here, this is the structure of chlorprothixene. So it is a typical antipsychotic which comes in the thioxanthine group. It is mainly used in the treatment of psychotic disorder like schizophrenia, bipolar disorder, mania, etc. And the other uses of this drug is they are used as pre and post operative pre and post operative condition, the treatment of anxiety and insomnia or sleeplessness. Then it causes severe nausea or emesis in hospitalized patients. This particular drug, it will reduce the anxiety as well as agitation in people who are addicted to alcohol or on withdrawal of opioid drugs. Okay, so when the drug when they stop using the drug, they'll be showing some withdrawal symptoms. So in that case, they'll be showing some anxiety, agitation and all those things. To reduce that, this particular drug is being used. Apart from this, it also has antidepressant property. It is used as a co-medication in treatment of severe pain. Okay, so it has analgesic effect. Also, it has anti-emetic properties. Next drug is thiothixene. So this thiothixene is also a thioxanthine derivative. It is related to chlorprothixene and it is used in the treatment of schizophrenia and bipolar mania. And this particular drug, it mainly acts as an antagonist on the dopamine D2 and D3 receptors. It also has antagonistic action at the H1 receptors, then alpha 1 adrenergic and serotonin 5-HT receptors, that is 5-hydroxytryptamine receptor. So it will be producing various effects. Then this particular drug, it is being contraindicated in patients with circulatory collapse, that is those who are having cardiac related problems. In those people, this drug should not be used. And side effect is tardive dyskinesia, that is nothing but involuntary body movement, that is face, neck and certain parts of the body, there will be involuntary movements will be there, that is called as tardive dyskinesia. So these are the uses of thiothixene. The next drug is Clozapine. So it is not a thioxanthine derivative, whereas it is the dibenzoxazepine derivative. So here you can see there is one benzene ring, here another benzene ring, and this ring is the middle ring is a 7-membered ring. It consists of 2 heteroatom, one is oxygen and there is nitrogen. So it is the dibenz, that is 2 benzene ring, ox is oxygen, asa is nitrogen. So it is the dibenzoxazepine structure. It is related to clozapine. Clozapine is the drug which is the next slide. Okay, so this loxapine, it is an antipsychotic drug which is used in the treatment of schizophrenia, and this particular drug, it will undergo metabolism by N-demethylation to form amoxapine, and this amoxapine is an antidepressant drug. Okay, so it will possess antidepressant property, and this particular drug, it is used as an inhalation powder for acute treatment of agitation which is associated with schizophrenia or bipolar disorder, that is mainly in adults. Okay, so it is used as an inhalation powder. Next is clozapine. It is a typical antipsychotic. So you can see here the structure, it is related to the previous drug, but here it is not the oxazepine ring. Here it is the dibenz diazepine ring. So two nitrogen atoms are there. Okay, so it is a dibenz, two benzene rings are there, dibenz diazepine ring which is being present. Okay, so it is a typical antipsychotic drug which is used for schizophrenia, which does not improve following the use of other antipsychotic. Okay, so if the psychosis is not controlled by other drugs, in that case this particular drug can be used, and it will also decrease the rate of suicidal behavior. Then the side effect is it will lead to decrease in the white blood cells. Okay, agranulocytosis. So that is, it will, this when you are using this drug for a longer duration, it will decrease the white blood cell count, so it will lead to suppressing the immunity, and in severe conditions it may lead to death also. So whenever you are taking this particular drug, the WBC count, the white blood cell count should be monitored in a regular manner, so that it should not be, there should not be any decrease, and it should not cause any other effects. Then other side effects which is related to these drugs are, it can cause seizures, that is epilepsy, then inflammation of the heart, then it can also lead to variation in the blood sugar levels, constipation. These are all some of the side effects which is related to clozapine, and it is used in people who are unresponsive or intolerant to other antipsychotics. So in some cases some drugs will not be tolerant to certain people, so in such case if other drugs are ineffective, this particular drug is being preferred, though it has some side effects. Next class of drug is the fluorobuterophenones. Okay, so the example is haloperidol. So you can see here this is the structure of haloperidol. So this haloperidol is an typical antipsychotic which is used in the treatment of schizophrenia, mania, in bipolar disorder, then nausea and vomiting, delirium, agitation, acute psychosis, and hallucinations, in alcohol withdrawal. Okay, so when you take this particular, okay, so, okay, so this haloperidol, if you take this particular drug, so it is an antipsychotic drug which is used in the treatment of schizophrenia and other bipolar disorder. Then it also has antiemetic property. It can be used in nausea, vomiting, etc. Then it is a long-acting formulation. It can be given as an injection every 4 weeks in people with schizophrenia. or related illness, who either forget or refuse to take the medication by mouth. So in that is mainly in people with the mania condition and all. So it is very difficult to make them take the medication. So in such people, this particular drug, it is a long acting formulation. So once in 4 weeks the drug has to be given. Okay, so thereby you can avoid the in between drug delivery can be avoided. Okay, so that is one of the advantage of this particular drug. It has a longer duration of action. So once in 4 weeks the drug can be taken. Then the side effect is tardive dyskinesia. So tardive dyskinesia, it may become permanent. That is, if it is used for a longer time, it will lead to tardive dyskinesia. That is a side effect. So tardive dyskinesia is nothing but involuntary repetitive body movements. Okay, shaking of the head, neck, or particular part of the body. Then some examples are sticking out the tongue. So always they'll be doing that. So the rapid jerking movements will be observed, either in the neck part or some limbs and all. The jerking movements will be, and some muscles and all, it will become rigid in some cases. So these are all the side effects which is related to this drug. Now this is same haloperidol. So it is a buterophenone. It is used in the treatment of schizophrenia and delirium. It has many extra pyramidal side effects, but low hypotension and low autonomic side effects. Okay, so these are all some of the side effects which is related to that. And it also has sedative effect. Okay, then the hydroxyl group, if this hydroxyl group, it is being esterified, in that case you get different derivatives of haloperidol. And the mechanism of action, if you see, it is an inverse agonist in the dopamine D2 receptors in the mesocortical and the mesolimbic pathway. The next drug is droperidol. So you can see here, this is the structure of droperidol. Okay, so droperidol is an anti-dopaminergic drug which has anti-emetic property. That is, it is used to prevent nausea, and it has antipsychotic property. It is used as a sedative in intensive care patients. Okay, so it also has sedative property. So it is a central anti-emetic drug, and it will prevent the post-operative nausea and vomiting. That is, in people who are given general anesthesia, nausea and vomiting is one of the side effects which is related to general anesthetics. So so after the surgery, post-operation, in order to prevent nausea, so what will happen if suppose the person has undergone some cardiac surgery, and if he starts vomiting, no, so it will lead to difficulties in that particular person. So after the surgery, the person should be calm, as well as he should not have any nausea, vomiting, and all those things. So to prevent that, this particular drug is used. And it has antipsychotic action in the dosage of 5 to 10 milligram. It is given as an intramuscular injection in people who are severely agitated and who are refusing to take oral medication. Okay, so those who are not willing to take the oral drug, or those severe psychotic conditions, this particular drug is given as an intramuscular injection. And apart from this, it can also be used in the treatment of vertigo problems. Next buterophenone is risperidone. This is the structure of risperidone. So it is a typical antipsychotic which is used in schizophrenia, bipolar disorder, and irritability associated with autism. That is mainly in kids. Okay, so autism is nothing but it is a developmental disorder which will have difficulty in social interaction. Then communicative difficulties will be there, and those autistic kids, they will be showing some restricted as well as repetitive behavior. So their thought, thinking, memory, attention, and all will be little bit lacking, or than the other normal child. So they'll be showing some hyperactiveness and some repetitive behavior will be observed. So they'll have some learning disabilities also in those autistic kids. Then side effect is tardive dyskinesia, then neuroleptic malignant syndrome, and increased risk of suicidal tendency, then high blood sugar level. These are all some of the side effects which is related to risperidone, and it is a mainly it is a act as a dopamine antagonist and serotonin antagonist, and it is also used in treating obsessive compulsive disorder. Obsessive compulsive disorder is also a type of condition which will lead to anxiety. So in that treatment of that obsessive compulsive disorder also this particular drug can be used. The next drug is beta aminoketones. That is the structure is, this is the structure of molindone hydrochloride. So molindone is an antipsychotic which is used in the treatment of schizophrenia. It will mainly act by blocking the effect of dopamine in the brain, and thereby it will lead to diminished symptoms of psychosis, or it will reduce the symptoms of psychosis. So this is the structure of molindone. So you can see here, this is the molindone derivative. So this ring is the cyclohexanone ring. Okay, and this is the pyrrole ring. Okay, it is being fused together. Then the last drug is benzamide sulfuride. Okay, so if you take here, this is the benzene ring along with this C double bond to NH2. That is benzamide. Correct, no? So this is a benzamide derivative. So it is sulfuride. Sulfuride is an antipsychotic drug. It is used mainly in the treatment of psychosis. That is mainly in treatment of schizophrenia, and it is also used in other depressive disorders, and in low doses this particular drug, it is being used to treat anxiety as well as mild depression. And this particular drug, it is also used in the treatment of dysthymia. Dysthymia is a depressive disorder, and it is also used in treatment of panic attacks or panic disorders. Okay, so these are the drugs which are used as antipsychotic agent. So antipsychotics are nothing but the drugs which are used in the treatment of various psychotic illness, which will be which includes schizophrenia, then bipolar disorder. So bipolar disorder is nothing but in that there will be two phases will be seen. One is the depressive phase and another is the excited phase. So the excited phase, it is also called as mania. So so in the different types of this psychotic illness,